let me just state that I'm 79 years old, and my medical doctor says I'm in excellent health. I feel that I'm in excellent health, but I have used the Lifetimevibe daily, unless sometimes we were gone, but daily for the past 8 years. Both my wife and I have. And I can say that I don't want the machine. I need the machine for good health. It started out when I had, as you mentioned, your father-in-law had plantar fasciitis. For those who don't know, plantar on the bottom of the feet is the plantar area of the feet. What happens is neurologically, when the nerves become inflamed, you step on it and it feels like you're stepping on thousands of needles. And that would happen to me. I get out of bed, take a few steps, hardly move, and then slowly but surely I'd walk. But all through the day, I still had pain in my feet as I walked. But what occurred is that I went to the medical doctor, to the orthopedic specialist and also podiatrist, and he said, I think I can help you. Laid me on my stomach and brought my foot up, and in his hand was a needle 3 inches long. And he inserted that needle with steroid at an angle here, pulled it not all the way up, shoved it another area, excruciating pain, then came back another, all until he emptied it. And I cannot explain the pain if you've had a needle 3 inches long, inserted back through and forth, tearing through the flesh. But for 2 days, wonderful. Pain went away, but all of a sudden it came again. So I have used certain types of creams. I've used orthotics. I've paid $150 for a pair of tennis shoes and other shoes that were more expensive, $200. Nothing helped me. And I've tried Epsom salts and all these other things. So finally, when Vicki came up with this machine made strictly for seniors, I tried it, and within 3 weeks, never had another problem with plantar fasciitis. And since then, I have helped hundreds and hundreds of my patients. What I did was, before I retired, I had all the patients that I was taking care of use the machine first. Then I would take care of them. And I put out over 110 machines in patients' homes in the comfort of their own homes where they could use it. I had one lady come back and say, Dr. Cooper, I don't need you any longer. I got my machine. And I said, wonderful. But the thing is to me, this is the finest machine on the market. Now, I've used other machines. Almost all your other machines are made in China. I don't know anything that's made in the United States except this one, and of course, in Provo, Utah. But it is for senior citizens, and it works. It's gentle. And the thing I've noticed about in the past with Chinese machines, because I've had them before I got the Lifetimevibe, and I never had the success on my feet that I had with Lifetimevibe.
So tell me about your plantar fasciitis. So did you find relief after 30 seconds? How did you feel when you first stood on the machine?
When I felt, well, see, the thing is with plantar fasciitis, I didn't stand on the machine. I thought, if you got plantar fasciitis, I'm only going to put weight upon that. My whole body weight is going to be on my feet. So what I did, and what I love about the Lifetimevibe is you can put a chair in front of it, put your feet on your platform where you're not weight bearing. And so therefore, you can spread your feet close together, far apart, where you're comfortable, turn the speed up. There's different speeds. First is 0 to 30 is exercise, 31 to 80 is massage. And if you go through an exercise phase, then you hit massage, everyone says, I can't believe it. Oh, it feels wonderful because it's smooth and it's not aggressive on the human body. So what I did, as soon as I put my feet on that plate, I thought, oh my goodness, this feels wonderful. But I got up, still had pain, but as I did it off and on, and then it started going away, and then within 3 weeks, not even a bit of pain. As I started taking care of my patients, I had a patient by the name of Jim, and he's in St. George. He had radiculitis, that's radiating pain down the leg, on the right leg. And it's called sciatica to some people. But he dragged his foot as he walked. He just dragged that right foot. So I told him about the machine. He said, well, doc, I'd try anything. I've used medication, that doesn't help. I've gone to physical therapy, that doesn't work. So he tried the machine, and within a period of 4 days, he said, Doc, wow, I'm seeing improvement. I called him like 4 or 5 weeks later, said, "Doc, I'm fine. I have no more pain. I can walk, and it is, I am pain free also." For instance, I'll say to my patients, "Do you want to know how soon you'll notice the difference?" And they'll say, "How soon?" 30 seconds. I'm serious.
Wow.
In 30 seconds, you're on this smooth machine. It's general action. Your body will actually say, "I can understand. This is wonderful," because it feels so good. When you get on these other machines, they're so harsh, but this is so smooth, so it is easy on the muscles. It stimulates, contracts the muscles and the nervous system, and helps the blood flow. One great thing, though, is it oxygenates.
Mm-hmm.
As it oxygenates, it adds what? It adds oxygen to the brain.
So,
You know, I've got a lady right now. She's in Virginia, and she had called. I'm the consulting physician for the company, your company, and she had lymphedema. Okay, lymphedema is where the legs swell up. She had some sores. She'd been to a medical doctor on medication. Physical therapy wasn't doing anything, so I started her out by not putting any weight on her feet, but putting her feet on the plate, and then because she was in so much pain, I had her do it 2 minutes every 15 minutes because she was in so much pain. But she said, and she said that during the day she did 7, 8, 9 times. She said, "Dr. Cooper, the first night's sleep I've had where I haven't had to cry myself to sleep because of the pain." I had her continue doing this, and now she was up to 10 minutes every, what she said, every half an hour, only 3 times a day. But then I would have her go back to 5 minutes. The body loves 5-minute sessions when you're in acute pain.
mm-hmm.
See, but the thing is that as you are using the machine, I like to be consulted. Patients have certain problems because I've worked with so many people. I can tell them what to avoid. For instance, knees. All right, on knees, many times what happens is the meniscus membrane within that knee begins to dry out, and you use what we call lose the synovial membrane fluid. Okay,
Mm-hmm.
but what occurred is the body, if you don't exercise, you lose that synovial membrane fluid and it dries up. And so if it dries up, you're going to shrink what? You're going to shrink the cartilage also.
Mm-hmm.
So what we're talking about is letting the body exercise so it builds up the synovial membrane fluid.
So that's what that vibration, you just put your
exactly.
knees, put your feet on the plate, and while you're sitting in front of it, if you have a lot of pain,
Mm-hmm.
and that just circulates the blood and exercises the knee.